Hi, I'm Dr. Jamison Spencer. I'm going to talk a little bit about the popping and clicking that some people have in their jaw. If you have this, you know that it can be very annoying. People can make fun of you because they hear it at the dinner table, things like that. But a lot of people don't really understand what's going on in their jaw when it's making that clicking. Let me use this model here to explain how the jaw works. When our teeth come together, the teeth coming together dictates where our jaw is up in its socket. This lower bone is called the mandible. It comes up to a bone called the condyle or condylar portion of the mandible, and that goes into a socket. The in between these two bones is a disc, indicated here by a little yellow piece of plastic. When we open our mouth a little, the jaw rotates in that socket. When we open wide, the jaw comes down this slope. We call that translation. That's how a normal jaw joint works, and this disc should stay in between these two bones. If your jaw works like that, it typically will not make any noise, should not be painful, and again, that's how a normal jaw joint works. Now, someone who has a popping or clicking in their jaw, typically this is what's happening. When they bite down, their jaw will get pushed backwards, and the disc will come forwards. We refer to this as an anterior disc displacement. So the disc has actually become forward of the condyle and now is off of the joint mechanism the way it's supposed to be. When a person with this problem opens, they open a little bit and then the jaw goes pop on to the disc. They open wide, come back, it pops off the disc. So again, when they open and it pops into the right position. Open wide, come back off, on, off, on, off, on. So kind of the confusing thing here is most of my patients think that when their jaw pops, it's popping out of place. Whereas in effect, it is actually popping into the right position, and it's when they close down and their teeth come together that their jaw is technically out of place. So a patient with this problem, technically their jaw is dislocated all the time, except for when they open and it goes pop into the right spot. How we treat this condition is with a splint put into a position that we dentists refer to as centric relation. So by bringing the jaw forward just a little bit, the disc will line up, and with a splint between the teeth, that will help line up these tissues. For some patients, this can make a major difference in how they feel and how their jaw functions. So that's how a jaw displacement works, how a popping and clicking jaw works, and hopefully that makes that a little bit more clear on that when your jaw is clicking, it's probably clicking into the right place, and unfortunately your jaw is out of place the vast majority of the time.